Hi everyone. Today we're going to talk all about intraoral scanners. And this is a topic which I've been wanting to talk about for a very long time, but I've had difficulty talking about it because I was as yet unclear as to what my own opinions were regarding the intraoral scanners and how I feel about them. I've been using an intraoral scanner since 2019, so it's now 4 years of usage. And at this point, I feel sufficiently comfortable enough to tell you what's great about them, what's not so great about them. You might be feeling a lot of FOMO. You may see your colleagues purchasing intraoral scanners, and you may be feeling left out. I'm going to talk to you about whether that FOMO is warranted, whether you really need to worry about purchasing an intraoral scanner right away or should you be waiting, and really what are the things you can do and what you cannot do with the intraoral scanner. We're going to go into that in great detail. First things first, at least for the next 5 years, I don't believe that analog impressions are going anywhere. We still need them for a lot of our workflow, and especially the more complicated the workflow gets, the more reliant we are going to be on analog impressions. So don't throw out all that impression material just yet. And remember, an intraoral scanner takes things into the digital world, but at the end of the day, you still need something physical or analog to deliver to the patient, and it could be something as simple as a temporary. So we've found that, for example, temporaries itself is a lot faster to do the analog way rather than taking an impression or rather than taking an intraoral scan and then 3D printing. That's all going to be time consuming compared to just making a simple temporary. Another thing which you have to realize about intraoral scanners, as soon as you purchase that scanner, as soon as that scanner is delivered to your office, in probably a few weeks or latest by a few months, that scanner is going to be outdated because it's going to be the next best thing on the market, and this is something that you need to mentally prepare for. It is a very rapidly evolving technology, and you may have buyer's remorse by buying the latest and greatest thing at a very high price, because soon that price is also going to crash. Now, we can see a similar analogy in the printing industry, for example. Nowadays, it's safe to go out and buy any laser printer you want because the technology is stable, not much is changing. You get some features with some printers, you don't get some features. It's not a big deal, and the price fluctuations are not going to be huge. But because intraoral scanning is still quite new, even though it's been there 10 plus years, it's really getting mainstream now. I would say you still need to be very careful about this purchase and understand what you're getting and what you're going to be able to get out of that scanner. Now, before we get into the size and the ergonomics and the cost and the software and all of that stuff, let's talk about what you can and cannot reliably do with the scanner. What you can do is single tooth dentistry. So it's a single crown. For sure, you're going to be able to capture a very nice digital impression and get a very nice result with an intraoral scanner. And I would say this regardless of the brand. You're most likely going to be fine with any of them. For veneers as well, veneers are quite simple, and you can definitely get a good scan of your veneer preps with an intraoral scanner regardless of the brand. Now, where things get a little bit challenging is when your margins become subgingival. When your margins become subgingival, and we see it a lot, right? Someone who's had food impaction between two molars for the longest time, and now they've undergone a root canal treatment, and now they need a crown placed, but that margin is really quite subgingival. So now to capture that effectively with any scanner is going to be challenging, because even though it might look like you scanned that area perfectly fine and it looks fine on your laptop or on your device which you're using for the scanning, when it ends up on the lab side, and we get to see this because we do all of our lab cases in-house. So I see it on the software side in the lab in various software, whether it's the 3Shape software or the exocad software or whatever it is. We see that the resolution of those very deep subgingival margins is not as great as we would like it to be. It is difficult for the lab tech. Heck, it's difficult for even me to identify those very deep subgingival margins, because we look at it on the computer, it's blown up, it's nice and zoomed in, but it's not so crisp. It's not sharp enough. There's not enough resolution when we go down to the depth. If your preps are equigingival or supragingival, scanner, no-brainer, right? Very, very easy to do. We've had great success using intraoral scanners for 3-unit bridges, for 4-unit bridges. We've had it for crowns, not a problem. For veneers, not a problem. but we have had problems when we are attempting inlays and onlays. Now, inlays and onlays in the traditional sense with the diverging walls, they are, I would say, complex geometry. They are a little bit difficult to scan, but once you scan them, the design also becomes a little bit challenging. We have found much more success with a simple analog method of taking a simple impression with putty wash or polyether or whatever you want to do to capture those preparations of your inlays and onlays with complex geometry. We have not found great success. Now, if you're talking about inlays and onlays as your tabletop preps, specifically onlays, not inlays, but if you're talking about tabletop preps which have no geometry at all, where the occlusion is just lopped off and you're sticking on a piece of lithium disilicate, for example, those would be fine with the scanner because the geometry is not really complex for the scanner. However, I don't do those types of preps. I think they're very aggressive and very unnecessary, but that's a discussion for a different time. Now, you might think that if you're struggling with regular analog impressions using your putty and light body or your polyether or any other type of material, that an intraoral scanner is just going to make life so much easier for you. I don't think that's true. You need to really refine your skills and up your game with regular analog impressions. You need to understand how to retract the gingival tissues properly, how to prep your teeth properly, how to give good provisionals. The scanning is the very last part of it. Same way the impression is the very last part of it. So if you're struggling with regular impressions, your intraoral scans are not going to magically give you a better product because the scanner is very, very dependent on what you see because after all, it's light doing that impression for you. Sometimes you may have tissues or your margins which are a little bit below tissue where there's a hood of tissue covering that margin. Your light body material is going to flow in and capture that margin, but your scanner will not be able to capture that margin because there's tissue covering it and the scanner is not able to see it directly. You may have other situations where you have, let's say, a missing number 6 and number 7 has drifted into that space, so it's measly tilted. Getting an impression of this is not very difficult. Granted, you may lock into an undercut, but those you should be able to remove with a flexible impression material. But with scanners, you're going to have a real problem trying to get the contacts because you want to get the contacts of number 7, but they are in an undercut location, and trying to angulate your scanner in such a way to capture all of that contact detail of number 7 because you're making a crown on number 6 is going to be a little challenging, especially the first few times you do it. There's another thing I want you to temper your expectations about. Salespeople for intraoral scanners will typically walk into your office and tell you that this is going to drive practice growth, that people all around town are going to talk about this fact that you have this new fancy scanner and that they're going to come to you just because you have the scanner. This couldn't be further from the truth. The reason is patients do not really care what scanner you have, what brand, what model number. They don't care about any of that. They are most interested in getting comfortable restoration. They are not really interested in whatever technology you've invested unless it helps them get that comfortable restoration. So again, it goes back to you need to improve your skills first and then look at getting the intraoral scanner. So if your horizon is to, let's say, buy that scanner soon, maybe spend the next 6 months or the next year developing your skills to get perfect analog impressions first and getting perfect crowns out of your lab, and then look at the intraoral scanner. We did speak a little bit about the very deep margins being a problem for the intraoral scanner and difficult to kind of ascertain in the lab where those margins are. But there are certain things an intraoral scanner does very well. In my experience, the occlusion is usually much better with an intraoral scanner because we have eliminated certain variables, and those variables are your impression material shrinkage, your dental stone expansion, your articulation issues which could be caused by the technician, all of those things, or the over adjustment at the time of adjusting the ceramic. You know, sometimes the technicians place the final ceramic crown on the casts in the articulator and they tap, 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 and they adjust the occlusion. And as they do that tap, 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 the rest of the cast is getting abraded, and so they end up having hyper occlusion on your restoration. All of these problems are thrown out because it's all digital. There's less human intervention involved, and thus there's less chance of errors to occur. We spoke about some of the limitations, at least according to me: deep subgingival margins, inlays and onlays with complicated geometry. But what about implant dentistry? In terms of my comfort levels with implant dentistry and intraoral scanning, I would say I'm not quite there yet. I've tried using an intraoral scanner for many cases with single units or maybe a 3-unit bridge with implants, and somehow what never ends up coming out just perfect are the contacts. I always feel the contacts are either wide open or they are too tight, and those require a little bit of adjustment. The occlusion is usually spot on, but the contacts always seem to have some kind of issue. There's no issue in terms of the fit or the precision with which the tie base connects to the analog. None of that is a problem. Passive fit is not an issue, but mainly the contacts. Of course, if the contacts are too tight, you're not going to get a passive fit, but you know that it's not because of an inaccuracy in the implant impression itself. Once you fix those contacts, the fit seems to be fine. Think about how a scanner works. A scanner takes multiple images and stitches them together to give you this 3D composite image. And in that stitching process, minor errors are created. Now, that's not so much a problem when you're dealing with teeth because you have your periodontal ligament, which moves around to compensate for those errors. But implants don't move. And if implants don't move, you're now going to have an input, which is your scan, which has an error, and thereby your output will automatically have an error, and so your bridge, you may encounter a rock. Now, there are people doing full arch intraoral scanning, but even most companies don't recommend getting into full arch intraoral scanning because of this stitching issue when it comes with dental implants. Now, there are people who are successfully scanning the full arch for dental implants, but most companies themselves don't recommend this because of the stitching issue, which I earlier mentioned. And that's why technology like photogrammetry has come about, because this is a way to get a more accurate impression. Of course, that technology has its own limitations, but mainly the problem with that is going to be the cost. So as of now, as it stands today, intraoral scanning does not seem to be really great for full arch impression scans. But this has been my little issue with implant dentistry. I don't know if you've been having it. Please comment below if you've been experiencing the same as well. Now, if you're an orthodontist, of course you need to buy an intraoral scanner because a lot of orthodontic movements now are happening with aligner technology, and intraoral scanners are the way to do it. I think using PVS impressions for orthodontic cases is wasteful, and I think you're going to actually get much better results with using an intraoral scanner to plan your aligner cases. So if you're an orthodontist already, an intraoral scanner is a must-buy. I'm not going to go into, what system and what company and all of that, but you need to have some type of scanner. Make sure that your aligner company supports the scanner which you're going to get. So you now heard everything I have to say about scanners in general. But let's look at how do you go about selecting an intraoral scanner if you feel it's right for your practice. First, let's look at the ease of use. Now, the ease of use has various components to it, mainly the size and the weight, right? The bigger the scanner, the more difficult it's going to be. Many scanners in the market, you're going to find trouble reaching the second molar for a patient with restricted mouth opening. And most scanners, you're going to find trouble reaching the third molar. Even with adequate mouth opening, it can sometimes be challenging because the head of the scanner is quite big. Now, that is one thing. Now, what about the weight? The weight itself, if you're holding on to the scanner for too long, can be very unwieldy, and that's going to be a problem. And then there's the matter of the wires. Some scanners connect to the laptop directly with a USB-C cable, and that's it. They don't need any other external power, whereas other scanners need the USB connection for the data, and they need an extra power supply. So take that into consideration because you'll very soon end up in a situation where there's a mess of wires in your operatory which may not be very pleasing to look at and tends to accumulate a lot of dust. Another big feature to talk about is wireless scanning. Most scanners on the market are wired. There are certain wireless scanners such as the ones by Trios, 3Shape, and then there's also the DEXIS scanner, which was previously Carestream. Now Envista owns the Carestream intraoral scanning division, and now it's called the DEXIS scanner. So there is a model of theirs which is wireless as well. Now, wireless gives you a lot of flexibility. I've personally never used a wireless scanner. I didn't find the wire to be a huge inconvenience, but the wireless does give you a lot of flexibility because it's one less thing which someone could trip on and cause your scanner to fall on the floor and break. So wireless is a huge plus. And there are the naysayers, meaning essentially the competition, which says oh, these wireless scanners, the signal's not going to be so good, you're going to have interference. But most users who seem to have these wireless scanners are very happy with them. Another big consideration is hygiene. Are the scanner tips autoclavable? This is very, very important. If the scanner tips are autoclavable, that's great because you don't need to keep purchasing. But if they are disposable scanner tips, then that's going to end up being expensive for you because you need to keep buying for every single scan. That may not be such a good value proposition for you. I personally prefer the autoclavable scanning tips. And another very important question, accuracy and precision. Is the scanner which you're considering going to be accurate? Is it precise? Can you get repeatedly accurate results every single time? There are plenty of studies out there with every single scanner on the market, and they're going to give you the information you need in terms of accuracy and precision. I will say this though, most well-known scanners, and I'm going to talk about them soon, but most well-known scanners are accurate enough and precise enough to do your everyday single-tooth dentistry. Implant dentistry is another question, but on natural teeth, definitely single tooth or even 3-unit bridges or 4-unit bridges, you're good to go with pretty much any scanner on the market. One big consideration is speed. How fast is that scanner? Now, in my experience, I've tested a lot of scanners and I still think the Trios is one of the fastest scanners out there. It really captures images at a blisteringly fast rate, and it's very easy to use for that reason because you need about a minute to 90 seconds to capture an entire arch. Of course, things are going to slow you down if you have undercuts, if you have tilted teeth, if you have a little bit of bleeding, all of that is going to affect the speed. But if you're just scanning a standard arch, 60 to 90 seconds is fantastic. That's great speed. And I'm sure these scanners are going to get faster as time goes along. One big thing to consider is also the software. Now, you have scanners which are just scanners, and then you have other scanners which allow you to do a little bit of design as well. I'm not going to talk about the ones which allow you to do a little bit of design because I'm assuming that you're going to send the design off to your lab. In terms of software, that's a very important consideration because you need to see how frequently are you going to be getting updates, and whether those updates are free or they're included in your subscription, or how exactly all of those things work to keep your scanner running well and good, at least for the foreseeable future. I've also seen scanners improve over time. Even though the hardware remained the same, with updates in the software, scanning became much easier, much faster. It just generally optimizes the whole experience. So do not negate the importance of the software. It's not just about the hardware. Now, talking about software, this software also needs to actually be easy to use. It should just be intuitive for you to just pick up and get with it. For example, the 3Shape software is pretty easy to use. It's not very complicated. And it also has a killer feature for your subgingival scans, which is the HD scan mode, where you overlay a 2D photograph on the scan which you're taken. And I'm going to show you how that works right in this little clip below. You can see that we've taken a 2D image along with the scan, and as we look at this in the lab, it becomes very easy to identify where those deep subgingival margins are. There are other scanning software which is a little bit more complicated. For example, the Medit software is very full-featured. I love the way that Medit trims. They have something called polyline trimming, and whenever you scan, you're going to have some excess stuff on the side, and you need to trim that excess off. And Medit, the polyline trimming feature is just fantastic. So easy to use versus the 3Shape, which you have a brush, which is a little bit more cumbersome when it comes to the trimming. But besides that, the Medit software, when you look at it, could be a little bit daunting. It doesn't seem so intuitive because there are a lot of options over there and you're not sure what does what. But with a little bit of training, Medit is actually one of the more powerful software out there. So once you get used to it, I'm sure it's not going to be a problem. I've tested other software which has issues. For example, the Shining 3D or the Cameo, which is the rebranded Shining 3D, at least according to the distributor. The software at face value looks fine. It seems to work fine, but it has certain nuances, right? For example, when you're taking the occlusion, you want to scan just one quadrant because you're just doing single tooth dentistry, but the software forces you to scan 2 quadrants. So you probably would then end up scanning maybe 3 teeth here and 3 teeth on the same side because the software demands that you have 2 scans, kind of a left and a right as per the software, but you're kind of tricking it because you're doing quadrant dentistry. So that is one of the issues I saw with the Shining 3D. The other issue I saw with the Shining 3D is it was multiple units. We had done an occlusion scan on the right side, and then we moved on to the left side. We did the occlusion scan there, and both of the scans looked perfectly fine. But after the system aligned the scans, it seemed like one side was completely off, almost like the occlusion had collapsed into each other. And I couldn't find a way, or at least intuitively couldn't find a way to clear that scan and do it again. So I do think that Shining 3D needs to do some work on their software. I remember in the early days of using the intraoral scanner which we have, there were crashes which would take place in the software. But over time, that's got ironed out. The bugs get ironed out over time, and that's why those software updates are so important. Stability is something which could be a deal breaker for you, because if you've done all of that scanning and the system suddenly crashes, now you're going to be very, very frustrated with your user experience. Now, one big question to keep in mind is how much do these things cost, right? You need to figure that out and whether it's worth it for you to invest in it. So, for example, if you're spending a lot of time where you're in a remote location, you don't have a dental lab close to you, and a lot of time goes in the shipping of your case to the lab, a scanner is an easy decision for you, because you're going to at least cut back on the outbound shipping, because you're only sending them a digital file which is instantaneous. The lab will of course have to work on that file and ship it back to you, but your turnaround time is going to be reduced quite a bit, and you'll get your lab cases sooner. So if you're one of those people, I think you should just close your eyes and buy any of these scanners, and I think you're going to be very happy. In the initial days of intraoral scanning, a lot of it was subscription based, where you had to spend year on year after you purchase the scanner to get your software updates and to keep using the scanner. Fortunately, that seems to be changing as the market kind of settles and there's more competition. Manufacturers are realizing that nobody really likes the subscription model, so they allow you to pay upfront. So when you're discussing with your vendor, make sure that you're not getting into a subscription model, or if you are, make sure that that subscription model is something tangible for you, something which you can work with. I would say that AI scanning is a must-have feature, because you really want to have all those unnecessary artifacts be removed. For example, your gloves or the mouth mirror or the lips or the tongue, which randomly show up in the scan because of the way you held the scanner or because of the way the patient moved the tongue. Those are must-have features. So make sure that your scanner has some type of artifact elimination. They usually brand it as AI scanning because that's all the rage is nowadays. So now that you kind of have an idea about what to expect in an intraoral scanner, what it's capable of, what are its disadvantages, let's go into some of the scanners which I've tried out, and I'll tell you my honest opinion about them. So now let's talk about all the scanners one by one. Let's talk about CEREC. CEREC has the fanciest scanner that's called Prime Scan. It is the most expensive right now in the market, or at least one of the most expensive. And CEREC is probably the only solution which gives you same-day dentistry, because you can buy it along with the mill, which is integrated, and the scanner itself comes with an entire CPU and a computer and a monitor and all of that in a very nice cart, and it looks quite attractive. Definitely, it looks what you're paying for it. I've evaluated the CEREC Prime Scan. I was left a little unimpressed, because the cases I chose for the CEREC Prime Scan were again deep subgingival margins, and I was assured by the technician that the scan which we had done together for that patient was perfect. But because it was a deep subgingival margin, I also made a simple PVS impression, and I had the lab make 2 crowns. So on the day of delivery, we tested out both these crowns, and it turned out that the CEREC was short of the margin by about 0.5 millimeter. And that was kind of disappointing, because even in the design stage, the technicians helped me design that case. So that was, maybe it was just a demo issue. I know a lot of great clinicians who are using the CEREC without any issues. They are happy with it. So CEREC, if you have the budget for it, and if you want to do same-day dentistry especially, I think CEREC is the way to go. But definitely get a demo, make sure that it's up to your standards so that you're happy with it. The scanner which I have the most experience with is the 3Shape Trios 3. It's a wired scanner. There was a learning curve, and you guys are going to face this. Whatever scanner you buy, you're going to have a learning curve. You kind of have to actually do much better dentistry, because when you see your scan on the screen, you're going to be like, wow, that margin's not great, or this edge is a little rough, or this needs a little more polish. You're going to be able to appreciate all of that because it's now zoomed up in the big screen, And honestly, the first time I looked at it, I was quite embarrassed because I looked at my prep and I was not happy about it. So it kind of forces you to be a better dentist because the scanner is going to be much more sensitive to those inaccuracies, or at least it's going to make you more sensitive to those inaccuracies. But coming back to the topic, the 3Shape Trios 3 started out a little rough for us. With the software updates, it got better and better. And at this point, I'm quite happy to say I feel this is the workhorse scanner, right? This does most things. You're able to do removable prosthetics as well. I personally don't do removable prosthetics. I find scanning an edentulous ridge quite difficult. Scanners rely on a fixed point, for example, the occlusal surface of a tooth. But as soon as you move into the edentulous ridge, there's a lot of movable tissue, and scanners find it difficult to track where exactly to scan. So I've not gone into any kind of removable digital dentistry at this point. But the Trios apparently is capable of that as well. So overall, I'm happy with the Trios 3 from 3Shape, but there is the Trios 4 and the Trios 5, which have become smaller and they're wireless and there are more features. It's up to you to kind of decide whether that works for you, but always get a trial first. I also tried the Medit i700. Now, the Medit i700 is kind of similar in shape to the Trios 3, so I was kind of already familiar with it. I've already spoken to you a little bit about the software. At first glance, it's complex, but it's a very full-featured software. It gives you a lot of options, which I like, and I think that software is just going to get better and better. I have not really had too many issues with the Medit. We would compare it with analog, we would compare it with other scanners, and the results we got were generally fine. I have noticed that in a few cases we ended up having crowns or restorations which were maybe about 3 to 5% bigger than they should be. So the contacts were a little tight, the occlusion was a little high, but these are things that as you keep using a scanner, you kind of plan for it and you decide that in the design phase itself to compensate for these errors. But this is an error I kind of encountered. I would love to know in the comments whether you've felt the same with the Medit. Now, the Straumann Virtuo Vivo is a very interesting scanner because out of all the scanners I'm talking about, that is a very sleek scanner. It's almost kind of like holding just a wand, and it's very lightweight and seems very easy to use. But it has, in my opinion, two problems. One, I don't think the resolution or the accuracy of the scanner is that great. I've compared it directly with other scanners, and when we look at it in the lab, it seems like the detail is just a little bit lacking. Again, if your margins are supragingival, it doesn't really matter. We're talking about when we go subgingival, when we have an issue. But there's one thing about the scanner right now which is a deal breaker for me, and that's every time you take a scan, let's say you're scanning the maxilla, it immediately wants to post-process at the end of that scan. So every step there's a post-process. Post-processing is basically it looks at the scan, it refines it, it cleans it up, and it gets ready to send it to the lab. Most scanning software does this post-processing after you're done all the scanning work, just before you're going to send it to the lab. But the Straumann's Virtuo Vivo does it after every step. And that's a delay for you. That's going to take at least 1 to 1.5 minutes of post-processing, where you're sitting there holding the scanner in your hand, your patient's looking at you, you're looking at the patient, and you're just trying to bide away time as the scanner does its thing. So you would scan the maxilla, post-process, mandible, post-process, occlusion, post-process. This becomes frustrating and time-consuming. I really think Straumann is on a very interesting track with the scanner, but a lot of work needs to go into the software to make it more user-friendly and, most importantly, less time-consuming for the end user, which is us. Planmeca is another brand which I've tried. I've tried the Emerald scanner, and I believe now they're up to the Emerald S. Generally, if you look at the reviews, and at least my trial of the Emerald was not very successful. Now, granted, this was years ago. This is 3 or 4 years ago. They may have improved substantially. But I remember even the technician struggling with the scanner at the time of giving me the demo for the Emerald. So that brand at that point, and it seems like Planmeca is really struggling to catch up in the intraoral space, in the intraoral scanning space. I really hope they do catch up because more competition is actually good for us. And I'd be interested to try the Emerald S to see whether they've made any significant improvements in terms of usability, speed, and accuracy. Another scanner which I've tried, which is on the lower end of the cost spectrum, is the Shining 3D, also known as the Cameo. The Cameo is a rebranded Shining 3D. And this scanner was actually quite surprising, to be honest. I didn't like the scanning speed. I felt it could be a little bit faster. But I've already mentioned there were software issues where it seemed like the occlusion was taken on both sides perfectly well, and as I moved to the next step, the occlusion just collapsed on each other. Couldn't figure out why it happened, couldn't figure out how to redo the occlusion scan, and so I had to abandon it and just use another scanner to finish the case on that day. So software wise, I would say the Shining 3D still needs a little bit of work. The scanner itself is fine. We compared it with other scanners and we got decent or even better results. So as long as software updates are happening and they are keeping track of the problems which users are facing and they're willing to resolve it, I think it's a good starter scanner for you to go for. It's not 100% there yet. There are going to be caveats, and again, I keep saying the same thing. Please test these scanners out at least for a week on real patients, on real cases, to make sure that it suits your workflow and that it's giving you results which you like. There's one scanner which I still need to talk about, and that's the iTero. Now, iTero is the scanner which is recommended by the Invisalign company. They, of course, have a share in it as well. And what it is it's supposed to be a very fast, very accurate scanner. However, there is a challenge with the scanner. Why I would not consider it for restorative dentistry is the scanner itself is quite huge. It has huge head and it has a huge sort of body, and it's just very unwieldy and difficult, and especially difficult to manipulate in posterior regions. So for me, that scanner is not an option for restorative dentistry, no matter how fast or accurate it may or may not be. So let's wrap up this very, very long video. Most importantly, make sure that you are buying a scanner because you have an actual use for it, not because your peers and your colleagues and your friends are saying that you're missing out on something great. If you want to stick to analog impressions forever, that's fine. Just know that there are certain disadvantages to doing that. You could be faster with the scanner. And if you want to go all digital also, that's fine. But just realize that there are certain things which still need to be analog, and there's just no way around it, at least as of now. Whatever you do, please make an informed decision. Just don't be trigger happy and buy whatever lands up on your table on day one. All right? I hope I've confused you enough. I'm sure this video has been super confusing. So till the next time we meet, this is the Dental Review Guy signing off with a smile.